Welcome to Curlin's first of 9 presentations in a series of best practices in lighting as we move around the hospital. Today, we are going to focus on the ICU. I'm joined by 2 others of your Curlin lighting team, Chris Brownell, Vice President of Sales and Marketing, and Chad Eckhout, National Sales Manager. My name is Scott Teschendorf, and I'm the Sales Manager for the Central Region. Curlin Lighting, innovators since 1895, has 2 large divisions, architectural lighting and healthcare lighting. Today, we will dive into healthcare lighting, and more specifically, best practices for lighting the intensive care unit. Curlin has been a pioneer in healthcare lighting for over 50 years. In the late 1970s, John Curlin collaborated with cardiovascular surgeon Dr. Michael DeBakey of Houston to solve a life-threatening problem, inadequate lighting. Curlin's solution was to design the first generation recessed, aimable patient lighting with handheld control. In the 1980s, springboarding from our expertise in aluminum construction, we introduced non-ferrous luminaires for the MRI. Our 5 decades of product development and responsiveness to the market needs has led Curlin to become a trusted partner to the best-in-class medical centers around the world. Curlin is your solutions provider in every area in the hospital. As I mentioned, this is the first part in a series of 9 presentations that will focus on these areas around the hospital. So let's start in the ICU. The ICU has been described with some misconceptions. You may hear that this is an area of the hospital dedicated to the most critically ill patients, but really, we prefer to say this is a department for patients who have very specialized needs. They may need ventilators, blood pressure support, cutting-edge treatments, and close monitoring. In fact, the nurse-to-patient ratio higher here than any other area of the hospital. It is typically 1 nurse for every 2 patients. In other words, these are areas that are very specialized in the care they provide to their patients. So who's admitted to the ICU? Patients facing lung issues. We've seen this most recently this past year with the rise of COVID-19. Patients with cardiac problems. Patients with serious infections. Sepsis is a potentially life-threatening condition caused by the body's response to an infection, and patients that require close monitoring. The ICU consists of several different specialty departments within the intensive care. Medical ICU typically consists of adult patients with respiratory failure, liver failure, or blood disorders. Surgical ICU houses patients that recently had surgery or probably need surgery. Cardiac ICU are wards dedicated to caring for patients with serious or acute heart problems. Neurological ICUs came into existence about 25 years ago. These patients have problems involving their nervous systems. This area is devoted to the care of patients with immediately life-threatening neurological problems. Pediatric ICU, this is where children are taken when they require a higher level of quality pediatric care. And finally, neonatal ICU. This is an area designed for treatment of newborns specifically. Due to the nature of the specialized care involved in this area, Curlin will be offering a best practices presentation on January 15th of next year to cover this in more detail. Today, however, we're going to focus on the other 5 areas of the ICU. And with that, I'll turn it over to Chris Brownell.
Thanks, Scott. 3 major trends are affecting ICU design today. The first is that lines are blurring between the ICU and other areas in the hospital. Number 2, the world is finally recognizing the importance of sleep. And number 3, the current COVID-19 pandemic looks like it's changing the way that ICUs operate for a long time to come. Let's take a look at those blurring lines. Historically, the ICU has been a dedicated room with sophisticated equipment, but very limited surgical procedures actually happened in the ICU. Most of those took place in the operating room. Because patients were sick and immobile, then there was no need for bathrooms or showers in the ICU, and visiting hours were kept very limited. Conversely, the patient room was purpose-built for those lower-risk patients. And for many years, family involvement in the patient room has been encouraged through the use of family zones with couches and chairs and extensive visitor hours. We've also seen a trend for decades towards private rooms, private restrooms, and showers in each patient room. And the operating room has been where most surgical procedures occur, so infection control and a sterile environment are very important in that space. Now, what we've seen over the past several years is that the ICU is expected to behave a lot like a patient room and a lot like an operating room. So it's still that dedicated room with sophisticated equipment, but studies have shown that bringing the family into the ICU by opening visiting hours and creating a family zone in the space helps with recovery. Also, encouraging patients to engage in normal day to day tasks, like taking a shower instead of a sponge bath, or even walking to the restroom, aids with recovery and a sense of purpose. In addition to those patient room features, we're seeing operating room features in the ICU as well. More and more surgical procedures are happening in the ICU, and the COVID pandemic has only increased that trend. Because we're now seeing operations in the ICU, all of those sterility requirements from the OR are now present in the ICU as well. A couple common ICU procedures are a percutaneous tracheostomy, a perc trach, or a laparotomy, which is often a time-sensitive incision in the abdomen. So if the doctors and nurses don't have time to move the patient to an operating room, they'll do the laparotomy right there in the ICU. Sleep is very important in the ICU, and sleep deprivation has been linked to poor pulmonary outcomes, abnormal immune function, dysregulated endocrine function, and ICU delirium. So more and more hospitals are promoting sleep with active policies. There are three main things hospitals can do to promote sleep. Number one is to finally begin to use sleep disrupting medications judiciously and not overuse them in a way that affects patients. Number two is to reduce noise at night. And number three is to encourage proper lighting during the day and at night. The third trend that I want to talk about is the lasting impact of COVID-19. You could see on the left a window from the Cleveland Clinic separating an ICU room from the hallway, where a patient has written a kind and heartfelt message to the doctors and nurses who cared for her. On the right, you can see the current getup that a doctor needs to don to take care of a patient in a COVID world. That includes double gloves, PPE, a full suit, a respirator, and a face shield. And every time a doctor or nurse enters a new room, they have to put on a new set of PPE. This, again, is only accelerating the trend of procedures happening in the ICU room itself. You can't move a COVID positive patient through the hallway without creating tremendous risk for infection. So there are four main areas of lighting that are critical in creating this modern ICU that acts like an ICU, like an operating room, and like a patient room. And now Chad's going to take us through those four areas.
Thanks, Chris. We're going to take a look at clinical lighting first for the ICU, because of every lighting fixture in the space, critical lighting is the most important. If you take a look at an ICU, it's basically just like a patient room, except it's on steroids. Look at all the equipment on the left. Those are power booms from the ceiling, where they'll have medical equipment, they'll have monitors, they'll bring gases to the patient bed. And with all that clutter, what you don't want to do is add a ceiling mounted procedural light. The answer is Infrared Pro, either 45 or Pro 35 for your clinical lighting in the ICU. Why is there two models? Well, they both perform similarly. They deliver 5,000 foot candles on the patient, but they're different size trims. The 45 is a 19-inch trim that allows the fixture to tilt up to 45 degrees, whereas the 35 is in a much smaller 12-inch trim. And it really depends on the size of your room and where we can locate the light. So ideally, we'd like to put this right over the patient bed. Either model, you'll have full coverage anywhere on that bed. But as we all know, oftentimes we're not allowed to put our fixture right where we'd like it, even though it can be one of the most important pieces of equipment in the room. Things like patient lift systems or an HVAC vent might cause us to offset the light, and that's where the 45 can really help you locate it where you can to properly serve the patient bed. Clinical performance without the clinical appearance. Infrared Pro is better than those boom lights. And you see the boom mounted on the left, they're difficult to clean. They're a physical hazard when they're lowered down into the space. Portable lights, I talked to a lot of ICU directors, and they've got a 60-bed department with only one portable procedural light. As you heard from Chris, they're doing more and more procedures in these spaces, and they need to do them, and they need to do them fast at times. Go try to find that one portable light that's underpowered and impossible to find, and with a cord across the floor presents a trip and fall hazard. The answer is Infralet Pro, fully recessed, sealed and gasketed IP66 trims with antimicrobial finish, easy to wipe down and keep clean. And both the tactile membrane wall and remote control allows one-touch direction and intensity control really quickly, easily from anywhere in the room. All the Pro series has ultra-high CRI, over 95, in 3 different chromaticities to give the owner the color that they prefer. So now I'd like to take you back into that ICU. Let's take a look at the ambient light. Infection control is a huge issue. It has been, and now in a post-COVID world, it really is at the forefront. The problem is these frame-only downlights. They're open, they allow environmental air from the plenum to mix freely into the patient room and vice versa, bringing pathogens and bacteria spread throughout the entire hospital. For the ladder of care in the hospital, we offer 3 different levels of protection. And in the ICU department, you want to turn to level 3. It's ISO 5 Class 100 clean room downlights that have a completely sealed and gasketed trim assembly, housing, and J-box. The ICU department is the #1 department for hospital-acquired infections. The biggest being MRSA. You're probably familiar with that. So for years, we've been doing perimeter lighting in the OR in both 8-inch aperture and 7-inch aperture. And again, those are rated ISO 5 Class 100, sealed and gasketed. Now, for the ICU, we offer a nice 6-inch sealed and gasketed clean room rated downlight, and it's got only a 4-inch aperture trim assembly, so it's perfect for ambient lighting in the ICU. If you happen to have a room that doesn't have any natural light, there's no windows available, we'd recommend to you our tunable white 2-point, which will take you anywhere from 2700K to 6500K. Can be automated to perform like a circadian lighting system or natural light. And this could be a selection that you make, because unlike a patient room where a patient is typically in the hospital 1 to maybe 2 nights, in the ICU, it can be averaged 3 to 7 days or longer. So a tunable white system might be very valuable to the patients in the ICU. Moving on to wayfinding in the intensive care suite. This is a recent change, a development we've seen where, again, the ICU is more mirroring a standard patient room in that every patient isn't immobile, so that they're able to get up out of bed and use the restroom, which again is a healthy thing to get them up and moving. Also, they might want to allow that patient to take their own shower in lieu of a sponge bath. And then also you have family members now, a family zone that are starting to be designed into the ICU, and the family members need to use the restroom. So wayfinding is very important, and that can be done with night lights or chart lights in the circadian supporting colors. Again, the #1 complaint in the ICU department, just like in the patient rooms, are I can't sleep at night. So another way we can help with that is providing observation lighting in the intensive care area. Take a look at this image of a modern designed hospital ICU floor. And I love it. It's clean. It's really well lit, so you know that the cleaning crew is going to do a great job. And then the sliding glass doors are extremely popular. But how does a patient sleep on this floor at night? Well, you can provide switchable glass, can help dim that hallway lighting, its amount that gets into the room, and then also privacy curtains can help the patient to not experience any of that hallway corridor lighting. But what happens when the nurse or the doctor enter the suite at night? They're going to pick up all that corridor lighting, as well as they're going to turn the white lights on. And we just can't get our healthy sleep at night. So with that, we've introduced a observation light in 2 different colors. They're both melatonin supporting, either orange yellow or orange red. You can see the wavelength performance on the right. And just mount one over the patient bed, typically switched outside the room or just inside for the night nurse. And it allows them to enter, do their documentation and observation, and leave the room without reducing the patient's melatonin production, allowing them to fall asleep at night. And here's a look at one of those observation lights at Kirlin. The photo on the left is in our new behavioral health suite here at Kirlin, and that is the orange-red 6-inch product, providing that nighttime observation lighting. There is another method that you can use to do that. On the right is Kaiser Permanente out in California, their Sand Canyon project, where they designed in a chart light on either side of the patient bed. It's mounted about 6 foot off the floor, provides a little pool of red amber light for the night nurse. It's switched at the door. They can come in either side of the bed, do their documentation, and get out, again, without disrupting the patient. Back to you, Chris.
All right, so there you have it, a very quick overview of best practices for lighting the modern ICU with clinical lighting, ambient lighting, wayfinding, and observation lighting to promote health and wellness in this space. We tried our best to keep it under 15 minutes. I think we're at about 17, but please do join us every month for the next 9 months to focus on a different area of the hospital and best practices for lighting in that space. Next month, we have behavioral health, a space of growing importance on October 16th, and you can see the full schedule here. So be on the lookout for those invitations, or check kirlinlighting.com in upcoming events, and you'll see the registration for all of those sessions. Now we'd like to open it up for questions. All right, and to submit a question, just go to the questions area of the GoToWebinar control panel. You can type your question in. That'll come over to me, and Chad, Scott, and Richard and I will answer those questions as they come in. We've got one so far, and the question is there dimming on the nighttime observation light? And the answer is yes. That product dims down to 1%. So it's actually a great feature of the observation light, as you can turn it on at the lowest possible level and then increase the intensity as needed, just to ensure that you're not exposing the patient to any higher light level than is necessary for the practitioner to either observe the patient or perform whatever tasks they need to perform in the room while that light is on.
Yeah, standard 1%, you can get optional 0.1%. And with a good wall dimmer with presets, you can set that level exactly where you want the light to come up on or come up at.
All right, the next question is, will you be getting into UVC in any way? So we talked about infection control in the ICU, and we talked about COVID-19. One very well-known feature of the SARS-CoV-2 virus that causes COVID-19 is that it's super susceptible to UVC light as a mechanism to kill the virus. So that is something that Kirlin is working on currently in a product that will disinfect the air using UVC light. So just stay on the lookout for that. The ICU would be an ideal place for that, as frankly are all public spaces, as we all look forward to a time when we can congregate again the way that we used to. There's all the signs are pointing towards UVC light and like the 254 nanometer wavelength as a good mechanism to make these spaces safe and healthy. Yet again, the challenge being that UVC at those wavelengths is damaging to human skin and eyes. So there's a lot that we can do to ensure that no human beings are coming into contact with UVC, despite the fact that the virus particles and the aerosolized particles floating around in the air are in fact being addressed and killed by that UVC light. So the next question is, where is the best place to watch these videos on demand? So on KerlenLighting.com, we have a rep portal for our reps, and we have a specifier portal for everyone else. And if you register for the relevant portal to you, there is a section of the portal menu called Conduit Webinars, and you can watch all of our previous webinars that we've done recently, as well as this one will be posted next Monday. And as we go through these sessions on the monthly calendar, we'll publish those as we go. Also, all of these sessions are offered by the Kerlen team on demand. So if you go to our website, there's a resources tab. And then if you go to education within that, you'll see a link to request a best practices presentation. We've done dozens and dozens of those already this year since the dawn of COVID. And we love to do them. We love to do them in person, have a little question and answer after the fact. So while you're more than welcome to watch the video, we like it better when we're live. And depending on where you are in the world, your Kerlen regional manager will be happy to lead you, any customers, any colleagues, anyone who you think might benefit from seeing this presentation or any of the other best practices presentations. We're happy to do those for you. Next question is, I was trying to register for future events, but in the invite link, it only goes to the event for today. If we go to the website, are those links active? And if not, when will they be? They are not active at the moment. They will be active by the end of the day today for all of the upcoming sessions. And we'll send out an email as well to all the attendees from today's session with the links to register for the future sessions. So that will come out today or at the very latest on Monday next week. So the next question is, are there any further studies on the real effects of circadian lighting in hospitals relating to recovery time? And there are a number of studies related to circadian lighting, related to all sorts of variations of light levels in spaces around the hospital. We're happy to provide links to the most relevant studies, and thankfully more and more of those are happening every day. And we're getting more and better and more accurate data about what to expect when creating this circadian supporting environment for patients in these spaces. All right, I think that may be the last of our questions. So thank you all so much for joining this morning. And we are doing another session today at 12 p.m. So if you have any friends, colleagues, or loved ones who would benefit from seeing our best practices for healthcare lighting in the ICU, do remind them to join us at noon Eastern today. And look out for those additional follow-ups from us via email, or at any point if you want to go to our website, KerlenLighting.com, to get the latest and greatest from Kerlen. So thank you so much, everybody. Have a good one.